Welcome back to this educational video series on integrating yoga techniques within your hand therapy practice. My name is Bianca, the OT Yogi, and today I'll present a case study and then cover how a hand therapy treatment can look like for this client, incorporating the yoga techniques, including yoga postures that can be modified and built upon as the client progresses in therapy. Stay tuned. So let's consider a 38-year-old female who presents for therapy with pain, soreness, and weakness in her bilateral upper extremities following overuse with childcare and paralegal work. She demonstrates tension throughout her bilateral upper extremity with pain focused at the medial and lateral epicondyles bilaterally. At evaluation, she is provided with extensive patient education for postural awareness for work activities and child care, and she understands she needs to find ways to reduce sustained and repetitive movements. Based on her assessment, plan of care is set on reducing painful tension throughout the upper extremities, correcting posture, and prioritizing a neutral wrist position, and progressing to functional strength once appropriate. So after 2 therapy sessions with this client, the therapist has started to notice that this patient has significant distress, evidenced by increased reported upper extremity muscle tension. In addition, she is concerned about the increasing limitations and feels unsure about effectively managing her symptoms. The patient constantly requires substantial affirmation and guidance on how to manage her injury at home, suggesting she may have a low self-efficacy in managing her upper extremity injury outside of therapy. So a session with this patient, including the yoga techniques, could look like performing wrist passive range of motion while the patient listens to a 5-minute guided meditation with breathing techniques to encourage muscle relaxation throughout the body prior to starting to those therapeutic activities and exercises. And this can also be done during the fluidotherapy or administration of a hot pack. Then, prior to starting with therapeutic activities, it may be beneficial for the client to do a general upper extremity active range of motion exercise in order to reduce tension across the upper extremity. I will now demonstrate a flowing sequence that targets both upper extremity and postural muscles in coordination with the breath work. This coordinated breath to movement is what is called a vinyasa. And the series of poses that I will show you now is called a Sun Salutation A, and it's a series of poses that start and end with a mountain pose. I will now demonstrate a modified version of this without the weight bearing. So although it may not look like it, mountain is an active posture. In this posture, I'm actively engaging my core with my belly drawing towards the spine and grounded through my feet at a hip width distance apart with my shoulders relaxed. And I'm continuing to engage in my breathing, taking deep breath in through my nose and out through my mouth. Next is inhale, arms reach up in a mountain pose. This is good for bilateral upper extremity coordination. Then exhale, standing forward bend. As you can see, I have a slight bend to my knees. Here goes the side view. This is good for those posterior chain muscles to lengthen and stretch out, and at the same time strengthen core muscles for postural support. Now I'm holding on to opposite elbows, inhaling and exhaling for a couple breaths. And this is a gravity assist posture. As you can see, the back of my neck is lengthened and letting my upper body hang over my legs. Then exhale, forward bend, and have a long spine, and my belly is on my thighs. Okay, next is inhale, half lift, and this is where my spine is lengthened, spine is parallel to the floor, and I continue to have a micro bend to my knees. And next we're back to standing mountain pose, Tadasana, and now I'm actively engaging my core and slowly one vertebra at a time making my way back up, and my arms reach up. Next is prayer pose and standing, which is wrist extension for about 10 breath cycles. And for those patients that have limited wrist extension, active range of motion, you can instruct the patients to start off with their hands above shoulder level and slowly bring their forearms down until they feel a tolerable passive stretch, while making sure palms are fully touching each other and shoulders are relaxed. And in this posture, my core is still actively engaged. And now I'm doing a few wrist rolls in both directions just to get that extra blood flow to the area. Up next is an eagle arm pose variation with wrist rolls. So I have an overlap of my right over my left hand. Then I rotate my palms to face each other and I clasp my hands together. Then I'm slowly rotating my hands towards me until I feel a tolerable passive stretch. And then exhale, rotate away. Shake it out. Now I'm going to switch the overlap. Now I'll place my left over my right. And similar, face palms are facing. And now I'm rotating my hands towards me and away from me. And this is a little bit of a complicated posture, so not every patient will be able to get it right away. So when the patient is ready to advance to more wrist loading activities, the prayer stretch within that sequence can be supplemented with wrist flexion and extension exercises against the wall for an increased amount of wrist loading. In a typical sun salutation A, this would represent a modified half plank position, otherwise known as chaturanga. So to start off with, we're doing wrist extension. I'm placing my hands at the very top of the wall and then slowly bringing them down until I feel a good tolerated passive stretch. And I'm continuing engaging my breathing here, taking a deep breath in and out. And then if I notice any shoulder hiking, I try to relax my shoulders. And then while making sure my elbows are fully extended and my hands are flat on the wall. For patients that are yogis looking to go back into weight-bearing activities, it may also help to use visual imagery in this case, envisioning that the wall is the ground when they go into that low plank position. Up next, we have wrist flexion on the wall. So I'm going to place my hands on the bottom of the wall and slowly drag my hands where I still have the full dorsum part of my hands flat on the wall, slowly bringing it to where I have that good passive stretch. And then same thing, looking for any shoulder hiking and relaxing my shoulders. And during this whole process, I'm still actively engaging my core at the same time and continuing to engage in my breathing as well. And a good way to upgrade this activity would be to hold a towel against the wall while maintaining the stretch. And due to time constraints, it may be difficult to get the patient in standing. So I'm also going to provide a general active range of motion, seated stretches that can also be done with the breath movement pattern. First up is a mountain pose and seated. So in this posture, even if I'm sitting down, I'm still engaging my core. My belly is drawing in towards my spine. My feet are hip width distance apart and my shoulders are relaxed, and I'm continuing to engage in my breathing. Next is a neck stretch where I start to bend my head to the side while using gentle pressure from my hand to keep my head from bending. And I'm holding for about 10 to 15 seconds. And then I switch sides and I do the same on the other side. Alright, so next is a few shoulder rolls, forward and backward. And on that backward roll, you can give the patient cueings to pinch their shoulder blades together to get a little bit more of that scapular muscle activation. Now we're doing a side bend, and I'm using my right hand to wrap around my left hand for a deeper stretch. And the same for the opposite side. As I inhale, I raise up my left arm onto the side and up above my head besides my left ear. Up next is a seated cat-cow pose variation. I inhale, look up to the ceiling, arching the back, puffing out my chest with my shoulder blades retracting. I hold it here and then I reverse it again, where I focus on pulling in my tummy deep in and upwards, and my shoulder blades pull apart in protraction, and I round my body and I exhale. Up next is a modified child's pose on the table with a towel. So I first scoot myself back with this chair, and then with the towel, I'm going to slowly start to lean forward towards the table until I feel a good passive stretch in my upper back. And I'm going to hold this for about 15 seconds, continue to engage in my breathing, and then slowly come back up while engaging my core. So this modified sequence provides the patient with a valuable tool for her home exercise plan. By integrating the breath to movement, it will help activate the parasympathetic system, which in turn will help reduce the tension she is experiencing in her bilateral upper extremities. In the same way, the seated modified sequence can provide a patient an easy way to do stretches while she's at work. So for example, the seated cat and cow pose can serve her as a functional tool that can work on those just right muscle groups that will allow her from going from a rounded posture to a more neutral posture. This approach will help minimize her daily tension, her daily distress, and in turn enhance her self-efficacy in managing her upper extremity injury and disorder. So these poses can be integrated into therapy, especially for those clients with repetitive motion injuries, nerve compression syndrome, or really for any client that would benefit from a full upper body active range of motion for postural support and help reduce tension across the upper extremities throughout therapy. So this is a session that can be billed for a 15-minute neuromuscular education session. It includes treatment designed to relax and stretch postural and upper extremity muscles. It incorporates breathing techniques, enhancing the blood circulation throughout the body, and foster a body-mind connection to reduce stress and anxiety associated with upper extremity injuries and disorders. Thank you for tuning in. In the next video, I'll cover early strengthening poses that you can use in your clinical practice.